As everyone knows, this administration has made health care one of the top 3 priorities in the administration: education, public safety, and health care. That has not been done since I've been involved in politics in Prince George's County. And we didn't do it by accident. Like the Lieutenant Governor, we understand that each of those first 2 that we named, education, public safety, have a direct correlation between health care, access to quality health care, lack of health care, health disparities, problems at home, have an impact on public safety and on education. So if we don't do anything about access to quality health care, then we can't tackle the other issues. And I wanted to make it a signature program of the administration. But I'm the county executive, and as they have told me, I'm not a czar or a dictator, that I need very smart, capable people on the second floor, and I need a leader who understands how important this is. We would not be where we are in pushing this agenda if it had not been for the chair of the council at the time, who, like me, thought health care was so important that she put her full force of her office involved in it, and that is Ingrid Turner, who did a great job. So I will close in thanking you for being here tonight. It is very important, as the Lieutenant Governor said. We are in one of our transforming neighborhood areas where we looked at health disparities, lack of access to health care, and quality health care. We think that we have a really great shot at having one of the zones here, so it's going to be important. And one thing, I'll close with this, and part of what's going to move health care forward is our ability to take chances and take risk, to not be willing to fail, because that's what research is about. Challenges and access to health care and solving problems and issues is about taking risk and failing and not being afraid to try again. So the innovative ideas and programs you come up with tonight will help Prince George's County and help the state come up with ways to deal with some of the chronic issues that we have facing the county and facing this state. Thank you.
So what we'd like to do, we're going to briefly introduce ourselves up here. What we have done here is tried to consolidate both the key elements of the enacting legislation that the General Assembly approved this past session, and then we're going to get into some of the draft principles and benefits that we have posted and asked for public comment. I'm not going to spend too long on any one slide so that we spend most of our time on question and answer. So let everybody introduce themselves so you know who's up here. My name is Ben Stutz, Lieutenant Governor Brown's Policy Director, and had the great pleasure of helping draft and scope this bill out with the Lieutenant Governor and Dean Reese and the entire Health Disparities Work Group that helped envision this program. So with that, I'll turn it over to my colleagues.
Okay, so you know that I'm Pam Kriegmer, Health Officer for Prince George's County.
Good evening, my name is Melissa Noyce, and I am the Senior Policy Analyst for the Maryland Community Health Resources Commission.
Good evening. My name is Arlie Wallace-Gist. I'm the Deputy Director with the Maryland Office of Minority Health and Health Disparities.
Great. Thanks, everyone. Okay, so can we go to the next slide, Chris? All right, so again, a little history here. The Lieutenant Governor covered this, but basically the way that we envisioned and got to health enterprise zones was that we had a work group led by Dean Reese at the University of Maryland Medical System pull together a group of approximately 15 academic and practitioners to really think through all of the different ways that we can help address health disparities throughout the state. So what you're seeing here has been vetted and analyzed and thought through by some of the top academic and medical practitioners that we have in the state. So once those recommendations were prepared to the Lieutenant Governor, we then undertook the process of drafting the bill language, which will walk through what the bill kind of encompasses. The Lieutenant Governor spoke about some of those incentives, and we'll go into those a little bit further. Also, the bill was appropriated this spring, thank you to the General Assembly, $4 million. What was not said was that in a budgetary time when most things are being reduced, the Governor and the General Assembly realized that this is money that spent well and in appropriate places would significantly return the investment that we make. So we know that it is infinitely more expensive to treat somebody in the emergency room than if they receive wellness and prevention and go to their doctor regularly to address their chronic disease. You go to the next slide. So when the work group was looking at health disparities, they really honed in on 3 key health disparities in the state. They were asthma, diabetes, and hypertension. And what we envision is that when an applicant comes to the state and says, here is the area where we would like to use our resources to address health disparities, we would hope that at least one of these 3 are part of your plan. So you're looking at the community and you're saying, we know we have a high rate of asthma among the children in our community. And we may also know that we have a high rate of infant mortality, and that is something that the funds can also be used to address, but we are looking for you to, in some way, shape, or form, recognize that these 3 chronic diseases are highly prevalent throughout our communities. Can we go to the next slide? So there was 3 components of the bill. The health enterprise zone was the kind of the largest piece from a financial perspective. The other 2 pieces that our league can speak to a little later are promoting cultural competency and health disparities data. The work group also recognized that in order to be effectively tracking our progress, we need to make sure that all of our practitioners are required to receive the right level of cultural competency when they are working with their patients. And the bill starts to flesh out how we can spread that cultural competency throughout our practitioner community. The other thing is data collection and monitoring. Chris, the next slide. So, as we mentioned, we're targeting communities. We're looking to improve the healthcare access and outcomes, and we're looking to reduce costs. 2 of the ways that the bill identified reductions in costs was the reductions not only in admissions to the hospital in the first place, but readmissions to the hospital. Next slide. So how will a health enterprise zone area be defined? So we've put out our draft thought about what a health enterprise zone area could be. We've said it should be a contiguous geographic area. It needs to have well-documented health disparities, and it needs to be small enough to allow the incentives that will be funded by the $4 million to have a significant impact on the community. So we're looking for a population of at least 5,000 people. So you'll see in our slides, we initially said, here are all the zip codes in Maryland. And we did zip codes because we have equal data for every zip code in Maryland on 4 key indicators. Some of you have said, that's too big an area. We hear you. And we're thinking about how we can address that issue. For example, in Baltimore City or here in Prince George's County, 1 zip code is going to encompass more than 5,000 people. So if you bring in an application and you feel as though the funds that you would like to use to address disparities would be best spent on half of that zip code because for whatever reason it geographically makes sense. It's bounded by a river. There's a commercial, stretch of land that kind of separates the communities. We're thinking about how you can help flesh that out for us and say this is the community that we really want to bring these resources to bear. Because if we only have 3 to 4 zones and we have $4 million, the straight average is $1 million per zone. Now, when you bring an application, you could say, we'd like more or less than that. That would be the, equal average among the 4 zones. But we know that if we spread it too thin, it's unlikely to see the change that we want to achieve. Let's go to the next slide. So who's eligible to apply? The legislation articulates who's eligible to apply, and those are the 2 primary applicants can be a nonprofit organization or a county local health department. So we'll get into more what we want to see in the applications, but let's go to the next slide, Chris. So who can receive the incentives? The legislation also articulates who are the practitioners who are eligible to receive the incentives, the income tax, the property tax, the hiring tax credit, the grant expansion funds for your practice. So you say primary care, behavioral health, and dental service providers. The next slide. So implementation, how this is going to work. Right now, we're in the public feedback stage. We owe the General Assembly a report, which we will submit middle of this month. They have 45 days by law to review it. During that time, we will start to think about what the request for proposal will look like. So we expect to have that back to the community to say, here's the framework, the final framework in which you should submit your applications by the end of September. We would expect applications to be in by late October, middle November, and we hope to have the selection of the sites completed by December, launch January 1. So you will be submitting applications to Secretary Sharfstein, the Community Health Resources Commission that Melissa is a part of. They have a lot of experience with grants and grant management. They have a standalone board which would be responsible for reviewing and scoring the applications. They make recommendations back to the secretary, and the secretary has the ultimate authority to designate the zones. Next slide. So feedback, we requested feedback on 3 documents. We requested feedback on the principles, the benefits, and the criteria, and I'm going to get into all of those. You see our forums. So you see that the formal public comment period was open in mid-June and closed last week. This, too, is part of our formal public comment process. So we've been recording these. We've been taking the questions down. They will be encapsulated in the report that we submit to the General Assembly. Next slide. Okay, so we talked about the eligibility criteria, the zip code, the 5,000 people. We had 4 initial screens that an HEZ must document economic disadvantage, and we define those by Medicaid and WIC participation rates. And we said an HEZ must demonstrate poor health outcomes either through a lower life expectancy or percentage of low birth weights of infants. That was our that's our draft. We've heard comments back that those are wrong, those are right, they need to be bigger, wider, etc. So let's go to the next slide and we'll show. So here we are in the Oxon Hill community, 20745. What you see here is the average life expectancy, the birth weight, the Medicaid enrollment, and the WIC enrollment. And on the slide here, what we've done is we define these in 4 quadrants. So the top 2 tiers of colors are in the 50% or higher median. So what we said is that in order initially for your community, your nonprofit to apply, you need to be in a zip code where at least one of these is higher than the median. That basically makes most of the state eligible. Not all of it, but a lot of it. Because we didn't want to make the first screen too onerous, because what we're looking for is innovation, capacity, sustainability, and impact. So let's go to the next slide. So the selection principles, all those things, impact, sustainability, that's what we suggested to you should be in our principles. And you see them listed there, and they're in more detail on the website. What do they mean? What are we going to be looking for in an application? Let's go to the next slide. So the incentives. So when we say there's $4 million and Dr. Joseph is an applicant, and he comes to me and says, I would like my group, my nonprofit, would like to apply for $1 million, and here's how we want to use it. If he suggests that he would like to use part of that money to incentivize additional primary care providers to that community or to grow his own practice, even if that money is in the form of a tax credit, it is inclusive of the $1 million. So if he's going to provide $100,000 in credits, he now has $900,000 left to utilize in his zone. Let's go to the, so, and just real quick, the Lieutenant Governor mentioned these. We articulated in the law, these are the types of incentives that are available. They're not exclusive. We asked in our draft, are there other incentives that you would like to see? And you don't have to use all of these. You may say, well, in my community, we know that if we had a lot of money spent on loan assistance repayment, we could attract young doctors and nurse practitioners to our community. Some communities may say, we don't need that. Johns Hopkins is 4 blocks down the street. So it's all very determinant on where you are and where you're sitting. Next slide. So we have the website. It goes through basically what I just said. I hope that I said it in a somewhat more precise, and I'm not really a dynamic speaker, so it's probably not any more dynamic than a website. But you can go on About HEZs, and those maps that you saw, you can click through the whole map. You can click on different Medicaid, and you can see the whole map for the whole state. You can zoom in so you can see exactly in your zip code. So what we want to do, and we're going to continue this throughout the process, is to create the most fair, balanced, and level playing field for everyone who wants to apply. So we know that some folks have a lot of data. Some folks have some, but they'd really like to know a little bit more before they make their application. We are going to try and make as much data available to everybody who'd like to apply so that there's no differences in terms of the access that you're able to bring to your applications. So I'm going to stop talking. I'm going to ask that maybe would Arlie would be willing to, not Arlie, I'm sorry, would Delia be willing to bring the mic around? Can I volunteer you? And we're going to take questions. We're all here to help. We all have different levels of expertise and knowledge. And so the floor is yours. Oh, I really couldn't have explained it that well. There's got to be a question out there.
I just want to ask a question about eligibility. You talked about infant mortality, Medicaid, birth weights, and so forth. What about the lack of insurance? In other words, the preponderance of uninsured individuals in a particular jurisdiction or a particular zip code. Could that be an inclusive criteria as well?
It's a good question. Do other screens allow you to be eligible? The answer is, in tandem with one of our overarching screens, yes. So it's no coincidence that the communities that have, high Medicaid usually, not always, have, lower levels of insurance. So you could articulate to us that our community has other things, other challenges that we believe need to be addressed. What we're asking for, I guess, to make it as clear as I can, is that once you're through that initial screen that your zip code qualifies, then you can articulate to us what are the other challenges in your community. Does that answer the question? Okay.
Yes, I have a question in reference to how the healthcare enterprise zones correlate with the Affordable Care Act. Specifically, where's the written procedures on how the Affordable Care Act will be implemented in the state of Maryland? So I want to see what the correlation is. And my second question is trying to get some insight on how businesses or medical businesses will be lured to these areas, or what kind of businesses or medical components will be lured. Will they be nursing care facilities, hospitals, clinics, nursing homes, people who do lab work? And so I'm just trying to get an understanding of who are we trying to lure to these business enterprise or these health enterprise zones, and the other, how will this correlate with the Affordable Care Act?
Good. Two very good questions. On the first one, how will this correlate with the Affordable Care Act? Because we are a state program, our rules, they do not, by law, have to dovetail with the Affordable Care Act, because this was not a part of the act. Another way to put it is our health benefit exchange in Maryland that we've established through state legislation, there are requirements in the Affordable Care Act that says you as a state implementing your exchange must do X, Y, and Z. But for this, it's the reverse. This is our idea. But on your point, if the secretary is here, he'd be much better at explaining this question. I can turn it to Pam for some other thoughts. But really what we see is these are dovetailing together. So we know that we're going to increase access to insurance to over 350,000 Marylanders from the Affordable Care Act. So these are in tandem. They're going to be supportive, but they really don't in terms of rules. They're not going to merge. I'm going to give it to Pam, but I do want to address your second question, which was in regards to businesses who might be interested in entering a zone. So part of what we've heard from folks is, I don't know who's in my community. I don't know who's interested in coming to my community. How do I get to meet them? What we envision is that applicants who really want to provide the best application will begin to network within their communities. They may go to the local hospital and say, do you want to join in our application? And the hospital may say, yes. We have a practice down the street that we would like to expand. We'll participate, but we would like to expand, and so $75,000 can be towards the grant money to expand that practice. Another thing that's come up, somebody asked in Baltimore, what if I want to bring a grocery store to my community? You could, in your application, articulate that what is needed in your community is access to healthy foods, and that you have a grocery who's been interested in coming in, but the finances just don't work. You could say that part of your grant funds, of all the money that you're using, would go towards helping that establishment come in. So let me turn to Pam for the Affordable Care, and we can talk offline a little bit more on that. But it's a very good question, and we are encouraging private sector to, the only thing the private sector can't do in this application is be the main applicant. That needs to be a nonprofit.
Thank you. And I guess the easiest way I would explain it is the health reform bill provides health insurance or coverage for people who are uninsured in a variety of ways. And it's not just that, but this HEZ is looking at creative ways to help expand enterprise or bring people who are going to provide care, and they're not telling us what it's got to look like, and gives us the flexibility. So it is just an added piece. It's like one of the puzzles. The health reform, expanding Medicaid, all of that, the exchanges in Maryland is far ahead of the rest of the states in the country with this, is amazing and a piece. But for Maryland, and in particular for Prince George's County, this will help us jumpstart our access to care issues with health, primary care, mental health, those kinds of things. Did that help you, or you knew that already? Okay. Thank you.
Dr. Shelby Wilson, School of Public Health, University of Maryland, College Park. So I wanted to say the School of Public Health because what I basically primarily heard so far has been more of a medical determinants of health model with the health enterprise zones. So if you think about the CADUSA staff, it has two snakes. One is medical, one is public health. We're primarily focusing just on the medical snake with this the bill. And so for me, my concern is when you think about addressing health disparities, we really need to look at the intersection of social determinants of health and also environmental determinants of health. So of course, planning, zoning, the built environment plays a major role that you have access to. So when you think about health promoting infrastructure, it's not just health care and dealing with the medically underserved areas and access that way. It's also other kinds of health promoting infrastructure that needs to be included. And so my critique that I sent in was really about being more inclusive of really how you can improve health from more a holistic perspective and providing those communities that have some issues with access to parks, green space, supermarkets, farmers markets, those sorts of things will be able to apply. And incentives would be to get more block grant money, for example, or to bring in that grocery store, or to work with the local school to address the issues of food disparities and food injustice that may be in that community. So I would just like to see the committee, when it comes to the criteria for eligibility, the review of the applications, that there's more room for those other determinants, both the more the social determinant sides, but also the environmental determinants of health to be in there as well.
Those are great comments. We've heard similar thoughts, and we, as I mentioned with the grocery store example, and we articulated in the bill, we do envision that applicants should be thinking about the public health aspect, if that's community health nurses, if that's other public health programs that can help address disparities. There is a limit based on the dollars and based on our scope as to how much of the social determinants of health. But for example, if a rural group were to come to us, and we heard this during our discussion, and said, our issue is transportation, that can be part of your application. So we do hear you. It's a great point. I don't think we have enough money to address all of it, but we certainly know that they cannot we cannot succeed without them coexisting. Absolutely.
So, Dr. Wilson, having both read your public comment and being from public health, I also appreciate everything you had to say. And I'm also going to put you on the spot because I think all the coalitions and people who are on the ground and starting to work through what their community needs need someone like you and other public health people who really know that it's not just about the medical side. There's a lot of different things that go on to make someone healthy or not healthy. So having expertise from the universities and from the people who are there every day working, I think is going to be critical to the Health Enterprise Zone's successes. So please volunteer your time. Excellent.
And I'm gonna actually transition this really quickly to Pam, so that she can talk a little bit about how the county is thinking through how it can be supportive of folks who are interested in applying. Every county's health department is thinking about this a little differently, and so I just want to give her an opportunity to talk about kind of where the county is right now.
Thank you, and thank you, Dr. Wilson. So I know your name and number. I have all of your numbers, so. Thank you. So for the health department's role in this, and we are very excited about it, but one of the main things is that we are going to serve as a resource for the entire community for this process. The other thing is we're all about collaboration, and I think every time and everywhere I go, I say collaboration because that is really the only way we're going to fix all of or even begin to fix all of our issues. But we're also going to take a leadership role as well in that collaboration because, as you heard the Lieutenant Governor and the guys who are speaking on this, there are going to be 2 to 4 It's not gazillions of dollars. We're talking about $4 million. And so we want to ensure that one of the, and they can't say it, but I can say that we are going to collaborate well, and we're going to have our goal is to have and endorse and support a broad and collaborative approach from Prince George's County. But we really would encourage one strong proposal for our county to ensure, and we're not going to say what it should look like, who should be a part of it, and all of this stuff. But what we do want to provide all of the support with data, partnering with any and everyone to get a strong proposal. So first off, the incentive program, it helps us boost our number one priority, access to care. If you're just looking on the medical side, we met talking about environmental health, and so we understand that as well. We need providers in every sector. So, and we have need. The beautiful thing is with the needs assessment that was completed last month and was reported out last month, we have an idea. We have data on where our areas of most need are. So we're all the way down the street with that. The last thing is, in the past, we are really liberal with our letters of support. I'm not saying we won't do that, but we, again, will say we want one strong, collaborative proposal for Prince George's County to guarantee that we are awarded. So was that clear? Any questions around that? And I expect we'll have some. Thank you. But we're here to support and engage the collaboration.
So my question has to do with the applicants. And so what happens, there are 2 to 4 zones eventually in the state, right? But presumably there will be more than 4 applicants. So what happens to the other applicants who have now gone and identified health disparities in their neighborhoods and are now keenly aware of health disparities that exist? Is there going to be some sort of technical assistance or follow-up to those communities to try to find maybe resources outside of the HEZ program to support their needs, which they have now identified in an application format?
That's a good question. It's something that we are also, again, still kind of trying to wrap our heads around. What I can say is that watching the Promised Neighborhoods application process come together, that was for the Obama administration's replication of the Harlem Children's Zone. We saw communities in Maryland come together. The governor and lieutenant governor supported the best applications. We have yet to be awarded one. But that said, the communities that have come together to think about the issues are progressing nonetheless, just by the process of really starting to think through how to address these issues. So I hear your concern that there may be a lot of communities that are not going to be awarded and they've spent a lot of time. We're going to think about how we can address that, but at the same time, I would like to emphasize that there is value in that process, and it shouldn't be put aside. Let me take a question on this side. So where's Arlie? Oh.
Orlean Grant with the Grant Group. Have a question on sustainability of the effort. This is a great initiative. It's groundbreaking. But one of the things in this type of planning that I haven't heard or maybe just not addressed directly is how is this effort going to be sustained once the $1 million is exhausted? Because there, as you said, the community planning is exquisite. There's going to be a lot to be learned from it. So is there going to be a part 2, or is the application expected to have built-in sustainability so that all these efforts, once that money is expiring, continue?
Very good question. So I wouldn't dare say that my boss, the lieutenant governor, was ever wrong, but we did. The General Assembly approved the program for 4 years rather than 3. What we do envision is that as an applicant, when you come in, you can articulate to us how you plan to spend the money over the 4 years. So what we are hoping, and we will still need to fight to keep the dollars there in the General Assembly, is that it's $4 million this year, $4 million next year, $4 million in year 3 and year 4. But you raise a really important point, which is, then what? And one of the principles that we really are going to be looking hard at is sustainability. How, if we are creating shared savings in a community by reduction in admissions or readmissions to local hospitals, how can we capture that? How can we make sure that if a hospital or the entire rate-paying system is seeing savings off of that, how can we make sure that some of those dollars can be returned back to programs such as the Health Enterprise Zone program so that it can remain intact? There's a lot of interest out there, I'll tell you, from carrier groups, MCOs, CareFirst, Kaiser have all come and said, we want to be a part of this. They know more than anybody that it's more expensive to take care of somebody when they get to the hospital. So that's just some of the thoughts that we've got out there.
My name is Renee Cohen. I'm from Senator Cardin's office, and I've worked on health care with him for a long time. Help me in trying to understand this. And so I hear this term, Health Enterprise Zone, which sounds phenomenal. And then what comes to my mind, and I want you to tell me whether I'm totally going in the wrong direction, or is this one of the directions? So when I think of that, I think of the people who live there. And this is the new approach. This is what's new about a health enterprise zone. To me, it talks to people, 5,000 people in a certain radius, X number of blocks wide, who then somehow find out that they live in a special place. And they live somewhere where the state of Maryland or the health department and all these other entities care about how they're getting their health care. And they're poor often, or don't have access to insurance or good food or anything like that. So what does that mean to them? And in my mind, it means that they then have, we're all talking about who puts in the application and how you do this. And I'm thinking, well, okay, that's up here, but what about, I'm having a problem figuring out how the 5,000 people really do benefit, not who the people are who are putting in the application to be running this enterprise zone. So I would think that these 5,000 people would know in their minds that there would be a place to go, some site where they then are able to have lots of needs met. Not just primary care, preventive care through a health practitioner or health, community health people, maybe not even a physician, but primary care, entrance care. And then what about all their other needs? My dad's not working, my mother has or I have somebody who maybe has a drug problem, somebody else, our house is falling apart. Are those people coming from the community able to go to this so-called site, call it a health house, whatever you want to call it, and be able to reach out and be put in touch with these other services, which is the public health part of it? I think that was just mentioned. I'm not hearing those tangents, those connections. So can you help me understand how they would come together? Because I think that's what would make a health enterprise zone really amazing and work.
So Renee, thank you for the comment. And obviously the Senator is a huge proponent for addressing health disparities. It's going to be a challenge. We want people to really think critically about how do the people in their community access services now versus how ideally they should versus how they could. For example, in Langley Park, we know that Casa de Maryland, Centronia, LAYC, and Impact Silver Spring work together all the time on child care issues. They knock on doors. They tell parents and mothers about local child care programs, about how to sign up for WIC. They do it in a bilingual fashion to make sure that the person who answers the door understands what you're there for. These are all components of what a health enterprise zone application needs to look like. So it needs to have, we know we have an FQHC in our community that needs to expand. We're going to put some money towards that, but we also know that the expansion is no good if it sits empty. We're going to need a community health nurse to go out to the community and knock on the doors. We're going to need to partner with the local nonprofit that has already established relationships in the community, at the grassroots, at the community center, wherever people congregate. Folks who are on the ground in their communities every day know how to access those folks much better than we do at the state, which is why when the Lieutenant Governor thought about how do we do this, we knew that the applications had to come from the community. The state was not going to be able to know how to provide that access at the same way that the community does. So absolutely, what you're saying is critical, and we're really focused on hoping, and we're hoping that the applicants think long and hard about how to marry the two. You can't just build a fancy new center and expect people to come to it. That's not going to get us to address health disparities.
So very quickly, I would also hope that for anyone who is putting together an application, that the people whom you hope to serve are part of that process and involved, and that it's not just one-sided. People know what they need, and they have a lot of value to bring. So I would encourage everyone to go out to whatever communities they serve and start talking to people, because people have things to say and will have a lot to bring to the table.
The only thing I want to add is the approach that our county has recently taken with our TNI neighborhoods is exactly describing what you've just explained. We didn't have resources to go with that. Our county executive said, I want every agency represented in these 6 neighborhoods. We heard about it in 1 week, and the next week we were on the ground for bus tours. And we're in 6 neighborhoods. Every agency has a team. We've done public engagement, we've done forums, we've done focus groups. It is an amazing thing, and it was the best way for me to learn about that. I'm on the Langley Park, Team Langley Park, so I could really speak well about what's happening in Langley Park and what's not. I heard from the residents what they need and what they want. But we had to start off with public engagement. We had no resources. We had no program. We had to find out. We said, if we know what's needed, we can tell people what we think they need. But the first thing we did was the first month was out in the communities as a team. Community developers, police, everyone, health, DER, talking to the residents of those areas. So it's going to have to include that.
You know, the policy issue, I don't know if you're familiar that the state of Maryland also received what's called a Community Transformation Grant from the Center for Disease Control. Within that is a huge component that involved your public health folks from Johns Hopkins, the University of Maryland School of Law, that will indeed help and give guidance in regards to policy type issues. That's not something that we can do because of our role with the state, but there is that resource. It is separate and beyond the HEZ that we're talking about tonight, but that is indeed available, and there is funding that has been put aside that it doesn't cost an individual anything to contact the law school. If you even go to our website, you will go and be able to see where it says the Institute for the Healthiest Maryland. That is a resource that the community at large can go to find out about those type of policy type of issues. It is one that will be in existence for at least 3 years. There are some issues that they put together where they say that they want us to have some accountability for that and to know how to actually sustain that program. That's just another program that I wanted to share, because I think it was raised by this young lady in the green when she asked that question earlier about the technical assistance. Well, even though if an applicant is not funded through this particular grant opportunity, there is nothing that would prohibit an applicant in those eligible rural communities to go and also obtain technical assistance type services. to enhance and improve their writing ability or how in which they collected the data. We're also looking at having a point where we can have an economist to come in to talk about the cost of disparities as well. So there are other initiatives outside of just the HEZ, because we know this is just a little small piece. $4 million is a small amount of money we're talking. So you have to really think large and big and be aware of other opportunities that exist for an applicant to actually tap into and refer to as they go into their grant application. And that is what our office is there for, to go and provide that information to you.
Reverend Robert L. Screen, River Jordan Project, community outreach nonprofit organization. I'm going to tag on to some of the things that were spoken to earlier in regard to applicants that will not be chosen, and looking at it from the perspective that it seems the money is driving the numbers of the number of applicants that are going to be accepted. But when an applicant has gone through the effort and energy to identify known tangible issues in a particular area or zone, there needs to be some type of an addendum to this program, even though they may not be selected, but they have identified a tangible need. And there needs to be something giving in terms of at least adhering to the information that's given, and those individuals or entities that have collected that information, that perhaps in the future this can be the driving force for future funding in those areas, for those areas of need. Because the needs are not going to go away. They've just identified, they just haven't been chosen, and they're just going to sit there. Thank you.
Thank you very much for that comment, and we'll certainly take that under consideration. It seems like it's something everybody has thought long and hard about, and it's a good point. One more in the corner.
Derek Berlage from the Park and Planning Commission. What's the application deadline?
I like it. Direct and to the point. We don't know yet. The application deadline will be determined based on when we get the RFP, RFQ out the door. So we're looking to get the RFP, RFQ out the door at the towards the end of September. So we would like to have applications in by early November, so that when we can review them and have a selection by December. So if I missed anything, I'll let Melissa, who's with the commission. Are we good? Is it I?
So the only thing I would add to that is we always try, whenever we put out RFPs, to give applicants the most amount of time that they can have to review the information, come together, and put together the best proposal possible. With that being said, do not wait until the RFP comes out. It'll be too late, I think, in terms of really coming together with a sound proposal. Start now in terms of networking and getting together and taking advantage of Ms. Creekmore's offer to help convene people, because most of the work is going to be done before the RFP is even out, I bet. So please start now.
So we were caucusing at the health department this evening, and we would really are looking for a date within the next 2 weeks to reach out to people so that we can just have a talk about what we want to do, what's possible, what ideas are in these brilliant minds, to go forward as one community, guaranteeing and ensuring that we have one HEC in Prince George's County. And the last thing I'm going to say before, because I think we're wrapping up, is as I'm thinking about those amazing proposals that are not going to get awarded, because we are talking about only $4 million, I'm just going to say a blanket response to that is I'm sure that there are multiple funding opportunities that amazing people in our community are going for. And what I'd like to say is, going forward, I'd love to see us work more collaboratively. So if it's not awarded, it doesn't mean it's dead in the water. We were not awarded the CMS grant. We worked hard on that, and we knew we were going to get it. But we did it in a fashion to say, well, we will shop that proposal around because it was an excellent product. So that's what I want us to do. We need to be resilient, and we need to keep it moving, and we need to add more people to the collaboration group. And as our county coalition is coming together nicely. We want this to be an ongoing thing. So great ideas don't need to die because one funder couldn't give it to us. So that's the last message I want to say. We've got a lot of innovating to do, and we have the smarts to do it here in Prince George's County. So thank you. With that said, it's a great turnout. I appreciate you being here. Thank you to all of our elected officials who've come out. And thank you for tolerating me as an MC, which is not my full-time job, but I'll work on it for the future. Thank you so very much. Mm-hmm.